That's one thing I love about what you do is you research, you're so open-minded, and then you actually try it with your patients. You say, look, here's something that can help. Here's some great studies that support it. It shows that it's safe and effective. This patient has brain cancer or breast cancer, whatever it is. Let's try it. Let's see and what happens. And then you get results. And then now you have, these incredible anecdotes and case studies. And I think when we spoke a couple of years ago, when I first met you and did my very first interview with you, you had told me that you had worked with thousands of patients and you had helped or seen hundreds or even thousands, please correct me if I'm wrong, of cases of cancer actually reversed using natural, holistic, or integrative methods. Is that true? Is that right?
Yes, yes. And to my surprise, many of them were stage 4 on palliative therapy and basically sent home to die. And when their tumor started turning around and they went into remission after several months, I couldn't believe it. It was like, what? Why didn't they know about this at the university hospitals? Why wasn't anyone teaching this?
Why is that?
Well, let me put it this way. There's huge investments that go into the university hospitals and into the healthcare systems that are profiting particular individuals, companies, and so on. And because of this, they're linked together with insurance companies, and insurance companies not only pay for the medications of the investors or companies that are profitable. So you see hand in hand this whole thing, and this is where it's for me extremely, how can I put it? Disappointing is one thing, but I would actually use something stronger than that, except I'd rather not, except to say that it is not fair to the patients to be limiting their support only to the financial interests of particular companies just to do studies. It's wrong. And what we're seeing now with the way cancers are reversing with complementary alternative medicine, off-label drugs, and so on. That's why I need to get more information out. We're trying to get a book finished just so everyone knows what I know and I can take a breather, probably for a week or two. But at least then we can get the information out, because I don't care who knows what I know. I mean, I put in 40 years of my life, not for me, but basically to help those individuals who needed the help. And from my own personal background, having a breast tumor at age 20, when they were going to do a radical mastectomy. And it was 2 months after my best friend was killed. So I realized this year, believe it or not, I realized, oh my God, that was probably stress. And now I realize for many of my patients that it's the stress that induces many of these cancers, because the immune system goes down. And that's the most important thing against cancer is our immune system.